Welcome to STEAM Powered, where I have conversations with women in STEAM to learn a little bit about what they do and who they are. I'm your host, Michelle Ong. My guest today is Robin Wiener, President and founder of Get Real Health. Robin is a leader and change agent in healthcare IT and is passionate about empowering patients for better engagement and outcomes. Join us as we speak about Get Real Health's digital front door, putting people first in healthcare and business, and finding your path. So good morning, Robin. Thank you for joining me today on STEAM Powered. It is wonderful to have you speaking with me today about your journey and health IT.
Thank you so much for having me today. I'm very excited to be here and just love the subject matter, really talking about STEM and talking about technology and talking about where your career can go.
Yeah, absolutely. And there's so much scope to move as well. We're not limited as we used to be in terms of what we can do and achieve in these areas.
Absolutely, absolutely.
So how did you get from human resources into, managing a health IT organization?
Exactly. So and this is something interesting when people are trying to make a career change. I was in retail. Retail is tons of hard work, and it's hard on your body, it's hard on all those kind of things. And honestly, financially, it's not a big win-win, right? So I had a friend of mine say, hey, you know what you should do is write down all the things you really love to do and all the things you really hate to do. And one of the things I really love doing is bringing teams together and building the right team, doing recruiting, bringing all those people together, which drove me to say, hey, wait a second, maybe there's something else for me to do. And that really brought me to recruiting and then from recruiting into the human resources side of it. So I've always been innate to actually build a team. And
Mm,
so what you got to do when you're changing a career or looking at something differently is figure out what you love and take what you love and see if it applies someplace else. And that's kind of what I did. And so with that, I got into recruiting and I ended up getting into recruiting at a technology company. So with that, I ended up working at, which is now Lockheed Martin, but it's a company called Aspen Systems. And I did recruiting for them and really learned how to bring the right technologists on, and not only technologies, a whole slew of different kind of careers. And I loved it. I loved it because you're changing people's lives by bringing people into the right career and bringing them to where they need to be. From there, I went to Wang, which is very, like, you don't hear that very often anymore, but Wang was a big technology company back then.
yeah.
And I really did real direct technical recruiting. And from there, I went to, and this is where my career kind of changes, into a company called US Web. At US Web, I took it from the technology recruiting and started to bring in the HR issues and starting to actually look at team building and you're bringing the right team together, but you got to bring them in and make sure that you're getting all the right pieces there. So it's taking it from a step from recruiting to learning about all the back end and how to actually build that team, making sure people are placed in the right place area and how they can grow in their careers. So that's really something I became incredibly passionate about and working really in this is back in the .com time. So there's a lot of startups, a lot of that happening. So really dynamic time. So sitting at the table learning, so I became the director of HR for them and sitting at
Mm,
the table with the other C-suites and or leadership group and really learned about what does technology do, how does it work, and how can we influence and bring the right people together. Everything from technologists to project managers to BAs, all those pieces, because it really takes a team to develop a product and be able to
yes.
understand how that team interacts. And then working on their personalities, because as we all know in technologies, a lot of technologists are more on the quieter side and then you
Mm,
bring somebody with a big personality and it can conflict and how to work through those conflicts and bring it to the other side. So we're at US Web, and that's when the .com time everything crashed.
yeah.
And myself and two of my partners, my business partners, even to this day, we decided to start our own firm, and that's when we started Get Real Health. And so I was the people person. I know how to be people, and I know how to sell. The other Jason was is to this day a solution, the most amazing solution architect in the world. I mean, he's been coding since I think he was, just diapers, and loves technology. And then Mark, and my other partner, is a networking guy and strategic strategy, be able to put the thoughts together. So that's kind of how we ended up starting Get Real Health, as by watching the .coms kind of blow up, and that's where we started form the Get Real Health side of it. So it's kind of been an interesting journey, but each piece of those journey, there's pieces that I can say it's all about the people, it's all about the team, it's all about growing loyalty and growing, putting people, I always say people smarter than me around me to be able to take it to the next level.
And so often people take for granted the organizational health aspect of a business, because it's about the culture and it's about the people and the way they interact and
Absolutely.
whether they can work as a team. And you're not just slapping a bunch of people together and hoping for the best.
No, you got to be able to put the right personalities together, give them the freedom to think. A lot of times, managers almost overmanage. They're always like, I looked, I actually a conversation with my team yesterday. My whole I had a company team meeting and said, "Hey, look, guys, we got to get sales going this year or whatever." And I basically said, "Hey, you're all smart people. Come back with me some ideas. What do you guys think?" And I don't care if you're, the office manager, or you're my solution architect, or you're my sales. You guys all know what you're doing. You all do it, and it's great. I've already been getting feedback, boom, 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 feedback of what we can do, where we can go, and etc. And if you empower people to do their best, treat them with respect,
Mm.
understand that they have lives outside of this location, you will, I think, get the best out of the people, and they will stick with you. For I've got a lot of people that have been there 17, 14, you know 10 years with me, a real group of them that have stuck with me ups and downs through all of it.
Yeah, and that's incredible because, in this day and age, that's not a thing that really happens anymore with job duration. Like a lot of people are changing, especially if you're in tech, you know, within, a couple of years each time. And, there's not a lot of longevity in staying in one position at all anymore. So
There
yeah.
isn't, so you want to challenge them, because part of the reason, and it's not always financial.
Mm.
Part of it is they want to be challenged, they want to be heard. They want to be in a situation where they're making a difference. And what we do for a living, we do make a difference. So they want to be part of that, and they want to be. Everybody wants to be respected. So if you do that, if you give them the freedom to do it, and treat them, just treat people well, you'll be amazed how many people stay with you. And then even people who have left are still in contact with me all the time. I mean, I got COVID early on in 2020, like one of the first people, and I
Mm.
had old employees calling me, sending me flowers, everything to see if I was okay. And so you want to build just the culture with inside the organization, but the culture around the world. And when things go wrong or you need some help, it's amazing. We always say it's a get real health family. You might leave, but you never actually leave the family.
Mm.
And that's a beautiful thing, that you can rely on all these different people out in the world and cheer them when they're doing well, even outside of where you were before. And then when something happens, you're the first ones knocking on the door to come over and say, "How can I help?"
Yeah, that's wonderful. It's so important so that they, a lot of people bandy about that it is, you're part of the company family, and that becomes almost too cliche because it's, just paying lip service, but it's really about making sure that they're supported as employees and as co-workers, whether or not they're still in the company. And it's wonderful that promote that.
I do. I mean, a lot of people out, in the company, they're still with me, and a lot of people help me grow the company.
Mm.
And when we get a win, they get a win. Even our clients, that have left and gone, we just hit 2 million patients up in Canada, and I called one of our, he's no longer with Telus, who we work up there with. He's in his own company, and first thing I did is I text Stefan and said, "Hey, we just did it, man. He's part of the journey," and
Yeah,
he was
exactly.
totally pumped up and totally excited about it. And so you want to be able to do that. And honestly, everybody out there, networking and keeping that. network of friends and colleagues and mentors are so important
It
because you
is.
just never know where your life will go. And it's great to be able to rely on people. And the only way you can do that is treat people in the right way
Mm,
and respect them and actually be their be their cheerleaders as they're
exactly.
going on with their careers.
Yeah, it doesn't matter where you are in your journey. Everyone needs support, and you've been part of that journey, whether or not it's been direct or indirect.
Absolutely, absolutely.
Wonderful. So, tell me a little bit about what Get Real Health is for our listeners.
So we are a digital front door, a digital health front door. So was like, what is that? What does that mean? So we've been doing like here's what another little cliche. So we started Get Real Health 22 years ago, and or it's 21, almost 22. Uh, we started as we came out of the dot-com world, right? So this is a crazy time. So we started as a professional services company, and just doing some professional services. We had really good developers, and we would go out and do different jobs and things, and just basically bring money. We bootstrapped it. We didn't take money, so we were literally working from our homes back when it wasn't popular, and just bootstrapped it. So we ended up working with a company and built out a health application and connected into that health application into Microsoft, and that was in Microsoft HealthVault. And Microsoft HealthVault, if for people who aren't familiar with this, and it's a phenomenal idea that this guy Sean Nolan, who was a chief engineer at Microsoft, and you want to talk about technologists? I mean, hands down, man, this guy is just crazy smart, right? So Sean looked at what was happening and here in the United States when we had the Hurricane Katrina,
Mm,
and some people might remember that or not, but for us here in the U.S., it was a huge moment in time. So that is when the hurricane came in and flooded New Orleans, and all these people lost everything.
yeah.
So think about all your health records. So you're sitting at your house is flooded now. So all your medication, all your records are gone. You say, okay, I'll call my doctors. Guess what? All those paper copies are gone, the doctors. All right, I'll call the hospital. They have servers, right? Well, that's when all the servers were in the basement.
Yep.
Well, what happens when a server gets flooded? It blows, right? So now these people are going into Dallas or into Houston, Dallas, Houston, etc., and saying, I have chemo. I know I'm in chemo. I don't know where I am in the process.
Mm,
Or I know I take a pink pill every morning. I have no idea what that pink pill is. So, what was Sean's concept, and this is where we just were like, oh my God, this is so right, is to take all that information and put it into the cloud. And this is just when the cloud concept was coming out, right? So
mm,
Microsoft was one of the leaders in the cloud technology. So we jumped on with that right away. We thought, geez, this is the right place to go. So we had just built this wellness program for a company, and we did the integrations into HealthVault. With HealthVault, with Microsoft, they loved I have just really super crazy smart technologists. I mean, they just hands down, right? Um, and the Microsoft guys I looked at the tech, basically at the code and said, man, this is really good code, really, really good code. Would you mind doing some more projects like this for us? So we connected Fitbit when Fitbit was 5 people.
yep.
Those 5 people have done quite well from Fitbit.
Just
So
a
we
little bit.
connected Fitbit. But one of the first things they asked, they connect us with American Cancer Society. I mean, no, sorry, American Heart Association. And we went down, we bid on building them a patient portal.
Hmm.
And so that was our first attempt at building a patient portal. So we did it as a professional service. We built out a lightweight patient portal for them. Um, we delivered it. They said it's great. And then they said, hey, can you do it in Spanish? And we went, oh, okay. No, we'll have to go back and do all this work. Right, right behind comes American Cancer Society. And they want almost exactly the same thing with a little twist, American Cancer Society.
Hmm.
At that time, we were doing a lot of work with SharePoint. And we looked at it and said, wait a second, there's a product here.
Mm,
We need to build a product that can be flexible, that can be in any language, and to be able to do that and be able to have different flavors of healthcare applications in the patient portal world. So
hmm.
bringing patient data in. So think about HealthVault being the database. We need to build something on top of that to pull that information out to give it an exposure to way for patients and doctors to see it. So we ended up building what we called Instant PHR, and this is where the product comes in.
Mm-hmm.
Instant PHR is not an application; it's a platform. So we're one of the first ones to get out and build a actual platform, and we built it so there's a content management system on the back end, and just think of like Legos, all these different Lego pieces. Pull your Lego pieces up, and you can actually build all kinds of different applications.
Mm-hmm.
And we're able to do it so we can build one that is a use case for cancer, use case for American for heart, or just a general one,
Mm.
right? So we've been doing that for years, and we ended up Microsoft came to us. They were kind of getting out of the business. They asked us. We built the database to replace HealthVault called CHBase. So now we've got the database. We've got all this great information going up through APIs, which are for people out there who don't know what APIs are. They're basically think about like little highways of that can be built to go from one data source. So your data source in your clinical in your hospital, and then connect into another place. So we built these APIs so we're pulling data from all kinds of different places. So right now we're just kind of showing this information. They said, you know what? What if we have all your devices, your Apple Watches and your blood pressure cuffs and etc.
Mm.
All that home care coming in there too. So now you get your clinical, your home care, and you can add information. So now we're bringing all in. And one of my favorite taglines is "See your patient like you've never seen before,"
Yeah.
because mostly doctors see you 3 times a year, maybe.
They only get a
What
snapshot.
happens if the doctor can see? Yeah, like it's not. What happens if they see what's going on all together and actually really bringing that all in?
Mm.
So we've been selling that for years, and we sell it around the world because of the localization. So talk about thinking about something you run into a problem, and then say, you know what, we're going to build this product, but remember that problem we had when we couldn't do it in Spanish? We had to go back and rebuild it. We said, wait a second, let's make sure, but not only doing it in Western languages, but doing it also in Eastern languages.
Mm-hmm.
So we have it in Arabic, we have it in Chinese, we've got it in Japanese, we've got it in Hebrew, and for especially Arabic and Hebrew, it's not left to right; it's
Yeah.
right to
Right to
left.
left.
So we built in a way to be able to do that. So that opened the international market for us.
Mm-hmm.
So we're international across the world. Just recently we've added on what we call the digital front door. So we've always had the kind of the patient portal.
Mm-hmm.
What happens if you go into a hospital system and they've got all these clinics that have a patient portal, and you have all these hospitals that have all different patient portals? So the patient is going from this one portal, that portal, this portal, and they're frustrated and they've got to pay a bill over here and they make an appointment over here. So what we're doing from one the largest non for-profit hospital system in the United States is we built one entry point.
Mm-hmm.
So all those APIs I talked about are now connecting into all those different EMRs. So it doesn't matter if you're in the hospital or you're in your clinics, all of it comes up, and we can do scheduling, secure messaging, virtual care, care plans, so video conferencing, secure messaging, everything is in one place. And that is what a digital health front door is to be able to give that patient, that citizen, because we do it around the world, a lot of large Department of Health, one place to do everything. And that makes your life easier. The hospital likes it because you can pay all your bills. You're not missing your scheduled appointments. You're talking to the doctors, and especially right now with the reduction of workforce in the hospital systems out there, to be able to have the patients do a lot of this online versus
Yep.
having to make a phone call or try to get in
All the
makes it big.
self-service stuff.
So that's a long way to get to what we're doing. So there we are. And
Absolutely.
that's what we're doing around the world.
That's amazing. And it's such an interesting problem logistically because even within, you know, between individual clinics and, financial groups, sorry, health groups, they all run different systems. They take their records slightly differently. You do have some, standards for medical records, but they're not always consistent and consistently followed. So how do you get through that challenge when you're integrating
So
a new group in and, trying to be compatible with your existing systems?
So one in the last, I would say, 10 years, standards have gotten better.
Mm.
They started off when we first started doing this. Oh my goodness gracious! As you being a developer, you just look, you're like, what? I mean, it was spaghetti code.
Yeah.
It was spaghetti code, spaghetti data. So trying to get through and getting them to some kind of standardization has been hard. But with really the support of a large groups, the Microsofts, the Googles, the Epics, the large systems all got together and really, through the government here in the US and then other governments around the world, really became up to standard something called FHIR.
Mm.
And FHIR standard is standardizing that data through all different areas. And here in the US, we have something called Meaningful Use, which actually forced the large EMR companies to actually have to define that to be able to do it because the hospital systems were not going to be able to get their financial pieces from what we call Medicaid and
Yeah.
Medicare here. And and then sometimes, at least in here, the margins are so small. So for a hospital to stay with an EMR, they would need that EMR to be able to go to the standards. So
Mm-hmm.
all the EMRs had to get off. There's still a lot of them are still using MUMPS, which is technology built in the 1960s. So they would have to update their technology to this new standards, and some of them are still doing it. They're absolutely still doing it. But with that, it ends up having these APIs that are more standardized,
Yeah.
and we're getting most of the information in a more standard way. Because one of the biggest things we want to be able to do is as we pull all that information into the databases, into CH we have the ability to do AI on top of that.
Mm-hmm.
So it is patient controlled, so the patient has a consent that they want to be, part of a
Yeah.
research study or a clinical study. If they want to do that, we want to have data in a way that is um, being able to bring that information together, to be able to get results, be able to do that, and is powerful.
Mm.
It's really powerful. Here in the United States, we have a lot of our clients in rural America, and those people never actually have the ability to get into clinical studies because they're not
Yeah.
exposed. Their information is not exposed into the National Institute of Health or all the big pharmaceutical companies. By doing this in the right way, we're able to actually let them their information be exposed to be able to connect them into those big places where maybe that's going to actually save their lives. So those are the kind of things that are good. But getting standardization has taken some time, but it's getting much. I would say in the last 4 years, there's been a huge turning of the tide, and it went on fast forward during COVID because all of a sudden everybody was working. It had to be from home. They didn't go to the hospitals,
Yeah.
right? They couldn't go in. So all of a sudden you got everybody's gone to telehealth. Well, they need to be able to see that
Mm-hmm.
information upfront and personal. So it actually forced everybody to move faster. In healthcare, it's always
It's a
do,
bit
do,
slower.
do, do, do.
Yeah.
This was like, just do it, get it done.
Absolutely. And that's just within the US, but because you're branching out to other countries as well now, how portable are the things that you've done now, which have been done to integrate domestically, done internationally?
Absolutely. Well, yeah. So FHIR, first off, most of the EMR companies are international. So the Epics, the
Mm-hmm.
Allscripts, everything is international. But even for those who are not, they have moved to the standards. Most countries, or at least the Western countries, have moved to the same standard. So it's very, so we are the the digital front door for all the citizens of Abu Dhabi, UAE. We're also for Canada, New Zealand, just signed something in Israel. So we're able to do this, and we're all over Europe. It because the standards are there, and we are connecting into most of these large
Mm.
governments. They already are there. Now we're coming out where when we go into countries that maybe are emerging countries, we're able to go ahead and transport that information into with a technologies to take that information that's kind of all over the place and be able to start to
Yeah.
sort it and put it into our FHIR standard to bring it back up. So, which will help them a ton, help that organization get it in there and bring it up. So we do a lot of
A lot of the
that
integration and the migration work.
technology stuff, but yeah, and it is, but what was really interesting is when COVID passports
Mm-hmm.
came out, and so that was at that time, the governments were not working very fast in figuring out how to do this. So there was a group that came together of all the top technology companies, and they really pushed the standards. And because of that, it actually made things go
Mm-hmm.
faster again. So, we were dealing with all of them coming together, all of them doing it in a big way. And because of that, again, more countries came on faster to get the standards in the same place.
That's incredible. And it's, yeah, a lot of people don't consider about the complexity of trying to integrate, especially multiple countries and multiple organizations who will do these sorts of things in very different ways and have evolved their own systems and infrastructure in different ways. And I know that one of the things that has been a bit of a bear for some people here in Australia is the fact that digital health has moved very slowly. And again, as you said, impetus was, COVID, but it's been a project's been progress for, a couple of decades around the same time you started doing your kind of work as well. And I don't know if this probably came up for you when you were working with Telstra Health, but we have the
Mm-hmm.
My Health My Health Record, which is the Australian government version
Yes.
of
Okay.
this, portal. But
I
it hasn't
I
gone
actually
very
went for that
well.
project. No, it
Really?
has not. So I actually was in a bid for that project many, many years ago,
Yeah.
and we didn't win. And they made some terrible mistakes. First off, that at the beginning it was where you had to have show your passport to be able to get in, and they just did it the opposite of so many things that are standard. And I know that the digital health, you got some new leadership over there
Mm-hmm.
now, and we're all hoping that maybe that will be able to do it. But they tried to tie it down too
Yeah.
tight. Made it difficult for citizens to be able to get the
Mm-hmm.
information, and they didn't do it in a patient friendly
Mm.
way. So one of the biggest things I've done with our stuff is say it cannot be something unique to healthcare. It's got to we have, of course, we have our mobile app. We're mobile first. It has to be as easy as using
Yeah.
Netflix. It's got to be simple. It has to be as easy as doing Facebook or whatever, because that is what people are used to doing it. Don't
Mm.
complicate it. Put the information where they need, give them the tools to be able to do it. And I don't think the government sometimes just get in their own ways and they go with the big consulting companies versus trying to go with something a little bit more
Mm.
nimble. And that is what happened in Australia is they went with a very big consulting company and they got in their own, they didn't they who didn't have experience in that piece. And there are a lot of not just us, other firms that could have probably come in and made it a little better. So we've been in those conversations, and I've been to Australia now 3 times, which is a big thing for us in the US, to be able to go to Australia, to New
Yeah.
Zealand, to be able to have those conversations, to say there is a smoother, cleaner way to
Mm.
do this. And I'm hoping for the Australian market. We're still working with Telstra. Telstra grew very quickly in the Telstra
Mm.
Health and overshot it a bit. And we still do a small project with them out of Melbourne. But I think they've kind of come full circle and is starting to put it together in a little bit of a better
Yeah.
way. But where Spark Health is down in New Zealand is doing some amazing things. They've got a great leader down there, Dr. Reedy, and he really understands what he's talking about. And they're taking the right approach. They really are, and of course, where they're using our system, but they are looking forward and they're thinking about the patients and the providers together and thinking about how we can do it
Yeah.
simply and how can we get the information out there. So it's a growing
It
piece,
is.
right? It is, it's amazing, and people do look to us a little bit because we have so many people using it. We're going to be at probably by the end of the year a little over 3 million people using it around the
Mm.
world. So learned a lot.
I can imagine.
What works, what doesn't work. What we did 5 years ago, we're like, oh my gosh, what were we thinking? So you learn and you adapt. You have to be
Yeah.
agile. It's all about being agile. And like anything in the world, especially healthcare, it's out of date very
Mm.
quickly. And if you say to the old, you're never going to get it. And that's why, again, going back to the team, to have these really sharp technologists and business analysts and strategic outlook is able to do it, and also talking to our clients and they talk to their patients and getting that, so it kind of pulls it all together.
And it's such an important thing to do because, everyone, it's your health is important and you want to make sure that, do get continuity care, that your records are kept, safe but accessible. And that was one of a few of the problems that came up with the My Health record, that clinicians were finding it difficult to get the data in, so they just weren't doing it. So records were inconsistent, they were out of date, and patients would be finding that it wasn't valuable to them, so they'd stop using it as well. So both ends weren't participating. And then on top of that, there was cybersecurity issues, and then there was trust stuff that happened as a result of uh, it wasn't very clear who had access to the data and how they were granting things like emergency access. And so once you break faith with privacy, it's hard to get people back on board again. So, one of the things,
It
yeah, so
really
one of
is.
the things with your system, because so many people are using it, how do you communicate, the safety, the privacy, and, integrity aspect of having your data online and accessible, which is awesome and amazing, but also at risk?
One of the things that we've always done from the days of HealthVault is
Mm,
patient controlled. You decide who is able to see your information. So that's very, very important. And we've actually never had a security breach, um, because you need to decide who you want to share that information with. It is not up to your doctors, it's not up to anybody else but you. So first off, that's the big first. There's consent module to be able to do that, but you have to tie it up as tight as possible. So they are, not just the passwords and etc. If we feel like, we've never had, I'm going to knock on wood here, we've never had a problem with that, and we monitor it all the time, and making sure that we do have the consent management, we do have the privacy. We have to go to our standards on privacy actually is in the
mm,
EU. So of all the places in the world, the highest standards
yeah.
are out of Europe, higher than Australia, higher than New Zealand, etc. So we have, because we have European clients, we have to go to that
You set
standard.
that as your baseline.
Yeah, it's my baseline, right? And then we go on top of that. We make sure it is secure, and we'll have clients say, "Hey, can I just look at it? They want to change the password." No, you cannot look at their information. There's no, there's nothing that is against the law. You cannot do that. You cannot do it. So there is privacy, and even for children. So there's a certain age of minority. So
Mm,
we even have that built in, say, and it's here in the United States, it's a real pain because it can be 14 in Pennsylvania, and right next door in New
yep.
Jersey, it can be 15. So we have to have this all set up in the back end to be able to do it. I think
Mm,
in New Zealand it's 14. So what will happen was as soon as you get to that age, you don't want your parents to see it anymore. It shuts off, the message is sent to them, and you can restart it yourself. And then you can invite your parents. You can make that
mm,
decision that you want your parents to come in. But we go down to that granular to make sure that that information is your information. You own it, you do it. When we talk about emergency access, what we have done with emergency access, we have a module in there. You decide that in an emergency, I want people to be able to get in and do it, and you should. So what we've done is built a emergency access. You go in, you say, this is information. You can pick which information you want the doctors to see if you go into the hospital. This is the information I want to say, and you can put in your emergency contact. My husband, whatever. So what we do is you can print off that emergency access and it's a QR code
mm,
that goes into your wallet. And if you go into the ER or ED, the first thing the doctors do or nurses will do is go through your wallet and find out that they can
yep.
scan that. As soon as that scan is, an alert goes out that that's been scanned and that's been
Hmm.
opened. So that message immediately goes to your loved one that something has happened, that somebody's in there, and a warning has gone out to you to say somebody is in there, and it's a 72-hour span that they can take a look at that, and it can be shut
Yep.
down at any time. So because we want to give people access, and now with QR codes being so prevalent after what we've been through in the last 2 or 3 years, that's a good way for people to be able to get in there and get that information quickly because could save your life. It absolutely could
Yeah.
save your life. But you decide what they want to see, you want anybody to see, and you can shut it off like that. So it basically is the ability to give somebody that, but so we look at all kinds of standard and privacy, but again, going to that EU standard.
And so useful. You've got Apple, which does the emergency ID thing, but being able to provide that level of detail and being able to have that communication aspect and the callback and uh, yeah, the phone tree kind of thing is So important, especially because, you're going to have family members who need the extra care, or they don't always have people around them who can provide that kind of support.
Especially if you're
Mm,
traveling overseas. If something like that happens, you want to be able to give them the ability to quickly get that
yeah.
information. And it doesn't matter. I mean, it can be in anybody has a QR code reader they will be at the hospital be able to open it up, but that will trigger that message to your family. So if I've got to go to UAE, I think in October. If I'm over in Dubai and something happens, my husband here in Washington will find out that something is happening and something is going on, and he can get to what I need, what has to be done. So those are the kind of things you want to be able to have in place, secure those things. So we do a lot of that kind of different things. Also, we've got alerts. So my son's a
Mm,
type 1 diabetic. So we have an alert system. So if Benjamin sugar goes up over 500, or more importantly, if he goes under 75, I get an alert on my phone and tell
yeah.
me that he's in trouble, and then I can GPS him. Having alerts for mental health, being able to know we have mood surveys that can go and say if somebody is having a crisis moment, they can reach out to either a person or a doctor. So having these other skills of just not looking at information, but actually doing something with that information that's going to support that person through a crisis moment is super important. With having a type 1 diabetic in the house, if he's really low,
Yeah.
he's not making sense. He's absolutely not making sense. So for me to be able, he has that continuous glucometer on him, to be able to know what that is, and God forbid he's someplace
Mm,
without people around him, I can get to somebody in the area to say, give him, some Coke or orange juice
yeah.
or something like that quickly. So as a mom, that's a huge piece. But we have all kinds of different things of those. So we're not just giving you information; we're giving you tools to handle your health, get the support you need from your family and
Mm,
friends and doctors to be able to do. You're really looking at the whole person and
that's
seeing
right.
what's happening in all from. And a lot of people forget about mental health, and that is such a huge crisis here
Mm,
in the world, right? To be able to control the mental, to really focus on mental health and what is happening there, and be able to, you know, that's a
mm,
disease also. Everybody always thinks it's something different, but mental health is just like having cancer or diabetes or anything like that. It is a disease that needs to have the support and the tools to be able to handle it in the same kind of way. So we do a lot of work there too. It's real. That's to me is having a 20-year-old son and seeing what the kids he graduated in 2020. It's very dear to my heart because there's so many friends he's lost
yeah.
because of it. So it's something that you really want to be able to go out there and support out in the world as best you can.
Absolutely. And, being able to provide people the tools to be able to help themselves as well is so important because not just with mental health, but even with any other medical conditions, some of the big issues is that people don't end up looking for help until they end up in ED. And by then, it's either too late or they have to start the
Mhm.
process in a different way, which is a lot more arduous. And if you need that kind of care, you can avoid the ED by having had intervention earlier on by being able to have that access to resources.
So, and what you can see is because we have a lot of different graphs and things. So you can start to see. So going back to just the mental health piece, we have a daily living,
Yeah.
right? So in daily living, you can go and say, I had a great night. I slept 7 hours. I woke up in a good mood. Blah 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 blah. But you can start to watch, and as yourself, you can say, wait a second, I'm starting to trend a different way. I'm
Mm.
not sleeping as many hours. I'm waking up. I'm angry. I'm anxious, or etc. I'm starting to see this. So you can get in earlier. Diabetes. If your sugar's running at this level a long time, the other thing that we do a lot of is because we can use the devices like scales and blood pressure cuffs and things like that. If you have somebody who maybe is not as much technology, maybe your grandmother, but every day you say to grandma, say, you know what? All I need you to do is step on the scale. That's all I need you to do. Just step on the scale.
Mm.
Well, if her weight goes up in 5 pounds overnight, she's retaining water, and is probably going into heart failure.
Mm.
So with that, you would get an alert and say, you know what? She gained 5 pounds. So you can actually jump in, maybe even get just a telehealth call going with
Yeah.
her doctor, and they can get her on medication to take that fluid off her body and calm the heart down. Or get her into the emergency room or get her into the doctor's office. So, but that one little tool, and it doesn't seem like a big deal, and it's not a big deal to her because she doesn't have to do the technology,
Mm.
right? You and your family are monitoring it over here, but that
Yeah,
goes up. You get an alert on your phone that says grandma just went up 5 pounds. We got to step in and see what we can do to help her. So it's really taking this to the next level and doing some like amazing stuff with it.
it is. And you're able to take the responsibility for some of the less urgent care factors to other people who can take it on. And you don't have to worry about either dropping the ball on it or burdening the system unnecessarily. And it's, yeah, it's
Absolutely.
such a useful tool to be able to have. And it empowers people to be able to look after themselves better.
Yeah, and that makes, right now in this day and age is I think people want to be able to know what is going on. We got
Mm,
pretty darn scared in the last, 2 years. And to be able to know how to go, even when you've gotten COVID, and I'm not sure how it is in Australia right now, we're having another whole round of COVID here.
yeah,
And my husband and my son just had it. Um, we went to Scotland, and I think anybody who goes overseas right now brings that's the gift you didn't want that comes home with you.
exactly.
Um, but it's but we're all vaccinated, so they were just bad cold. But to be able to go online and talk to your doctor right then and see if they can get you right on to the medicine now, because they've got
Mm,
medicine, and be able to
yeah,
have that conversation and just have it ordered. You don't have to go into a doctor's office and be able to do that, and then to monitor it, being able to check what your breathing is and etc. The doctors can monitor you from afar, and I think that's where something we really learned that actually really works,
mm,
where there was conversation 4 years ago that, oh, that would never ever work. It actually works. It's easier for the doctor. They can see more people faster, and you're getting the care that you need right away
yeah,
versus having, and you can see a doctor that doesn't, like here in the US, before you kind of saw your doctor right in your region. Now you
mm,
can see a doctor anywhere that can actually help you and get you the medication ordered, get you on that path a lot faster. So it is amazing to see how far healthcare has gone in the last 3 years. It's just
yeah,
amazing. It makes me very excited with everything and craziness going on in the world. That is something that is like, wow, you know what? We're making strides. We're getting there.
we are. So, because you were saying that, you can see clinicians who aren't local to you, does it mean that anybody anywhere in the world who has their records in the platform will be able to access it if they travel and if, they're elsewhere and, resettle, move, relocate, whatever?
Absolutely, they can follow you. It's so they're usually attached to a government or a hospital system.
Yeah.
So let's say you do relocate, you can download them and upload them into the country that you're in.
Mm-hmm.
Uh, Data does have to live usually within inside a, like in the
Yeah,
in Europe
geographic
is in the
boundary.
EU.
Yeah.
Yeah, but if you're traveling, it doesn't matter because it's all, you're going to give access to it.
Mm-hmm.
Eventually, if you do relocate, but there are ways to go ahead and download that information and then upload it into a new system.
Yeah.
And our system works with all the other ones too, so you can do it. Um, it would be nice to have a national, I mean, an international base, but there is privacy concerns about
Yes.
bringing it from one country to another country. And also where the data resonates. Here in the U.S., we have some problems in Europe because of the Patriot
Yeah.
law, and people get worried about that the U.S. will spy on you and etc. And we really had to. It is what it is. Yeah, and we really had to, this happened in Sweden, we really had to get into the press and say, that data is never leaving Sweden.
Mm.
That data is in Sweden, it is not leaving Sweden. We will not have access to that data, and explaining that. So there's certain countries that are very tough, certain countries not tough at all.
Yeah.
So, but again, we go to the EU standard and say that information has got to live. So you know, for all the work we do in New Zealand or in Australia, your area of the world, there is all the information is in New Zealand is located in New Zealand,
Mm-hmm.
and then all the information in Australia is located in Australia. Now, New Zealand and Australia do have relations between the two of them
Yeah.
that they can flow, but right now we are separate
Yes.
in both the different countries, and so that works for us. We try to keep it, again, going back to that privacy question. we want to make sure the privacy there. But if you're traveling, when I travel down, I get to travel around the world, and that information flows with me.
Yeah.
And God forbid something happens, they can get it. And I've got a heart condition, so I want them to be able to see it at any times and any place. I just happen to travel with a nurse too, which is one of the people who work with me, so that makes it much easier too.
Yes.
But yeah, no, it is definitely something you can do.
Yeah, amazing. So, one more question about all of this infrastructure and interesting stuff, because this stuff I love. It's fascinating to me having to consider the logistics of all of these sorts of things. So, with the okay, so we're still on privacy, but you've got
Hmm.
all the consent modules in place so that people can say what they can and can't see. But in the US, the Patriot stuff, as you were saying, um, if the information, like say part of the government has their setup and then they've got the information elsewhere, how do they consent to keep that information separate if the systems are connected? If that makes sense?
There's consent management between them.
Yep.
So again, it's patient control. Patient
Yep.
can say, I only want to share these 4 data points with that organization. I
Yep.
never want to share my information with that organization.
Yeah.
And when you get down to certain diseases, HIV, those kind of things, mental health
Yeah.
is another one that people are not, especially here in the US, I hate to say
Still
it,
the stigma.
they're not comfortable sharing it.
Mm.
And so what they will say, and now because of the changes in laws here
Mm-hmm.
on the abortion rights,
Yes.
people are very concerned about it, very, very
Yeah.
concerned because they don't want people to know if they've had an abortion or are going to get one.
Yep.
So that's become a new kind of a hot potato here
Mm-hmm.
of information. And again, it is controlled by the patient.
Yep.
They decide if they're going to share that information or not. And that's really important. And that's become something that we really, in the last, 3 months,
Mm.
having some real deep conversations about what does that mean? Because certain states here, you can, in certain states, you can't.
Yeah.
So going over the border and et cetera. So this is something that we already had built in, and thank God we did,
Mm.
because that is a issue for a lot of people. So yeah, no, it's again controlled by the patient.
Yep.
You decide. If you decide never to share with anybody, you don't share with anybody.
Yeah. And it's just understanding which parts of the information are relevant to show or conceal. So any medication related to, pregnancy or abortion or, additional treatments. And, you know, it's, yeah, the granularity of control is what's really important, especially when it comes to, the information being used for other purposes that aren't designed specifically for your care.
It really is, and we go very granular.
Mm.
I do not want to share that. I do not want to share that. I do not want to share this. If you're working with a trainer, maybe all you want to do is share your what you ate and where you worked out. That's all,
Yeah.
right? And so yeah, it can go to that granular that you're only sending that tiny tiny bit of information over to somebody. So yeah, no, that is the way we have always had it, and
Mm.
we will always have it, because it really does. The power of what we do is to be able to put the control back into the patient's hands. And I think that's where governments and other systems fall down a bit,
Yeah.
that they don't do that. We're all about empowering the patient,
Mm.
not making it difficult for them, giving them the rights, and giving them the ability to take control of what they want to take control of.
Mm.
And with that, people are, again, just even going back to building a team, and you give them the power to do that kind of stuff, they will take it and they will run with it.
Yeah.
But
Amazing.
keep it simple.
Yes,
Yeah.
absolutely.
Yeah.
Okay. So one of the things that you've mentioned is super important to you is, the idea of being able to encourage people towards leadership. And, this is something that you've done for yourself. So it's wonderful that, it's such an important thing to you to do for other people. So, why is mentoring such a big thing for you?
I think, again, I go back to having the right people surround you.
Mm.
But I look at people, and I happen to have some like learning disabilities. So back in my day, back in the 1970s when I was, sorry, the train's going by. In the 1970s, they just told my mom and dad that I just weren't as smart as my brothers and
Mm.
sisters, because I had dyslexia, and all those kind of things. So I saw how it was when somebody pushed you down and said you couldn't do something. Of course, my mother is tough, and she told them that they were stupid and they didn't know what they were talking about. She figured it out herself, what was wrong and how to help me. And I had a bunch of brothers and sisters that said, don't you call my sister that. And so I had the strong people behind me. But but that encouragement from my mom and dad and my brothers and sisters and my best friends really showed me that the power of positive around you and the people saying you can do this, and having that kind of making sure I can say that to other people in the world and it actually helped them grow. I mean, I guess they all call me the mama bear. I get so excited when I see people that I've helped to mentor, honestly, past me. One somebody I mentored and worked with a long time. She's now the CEO of United Care for up in United Way. So United Way in Rhode Island. She runs the whole programs for them for all. And so when you see that, you see this growth, and you see that it happens, it makes it really important. But I love working with, I've done some work with some of the kids in the high schools or in the colleges, and in telling women that they can do this and how important it is. I think it's really important. Women, I do a lot of women, but I also work with a lot of women, but I also work with a lot of young boys, and say you can do whatever you want to do. Just find that passion
Mm.
and be able to do it, and then just encourage them, saying it's okay to speak up in meetings. It's okay to put your ideas out there, and just grow them, grow them. And I make sure we're part of a larger corporation now, and I make sure that everybody knows. Well, a lot of times I will stand back and let them shine because I want them to be able to get the exposure within inside the organization. But I don't know. I just find it really fun. I love watching people grow. I love watching people being able to do things they never thought there was possible. And if that could be one of my legacies, it would be phenomenal. That's like, so I like it. It's a good thing to be able to do.
That's amazing. And it's such an important thing as well because, my thing is women in STEM. And, one of the issues is that we don't get a lot of women getting towards the C suite and in leadership roles in academia and all of that because, firstly, there's a limited number of roles available. But for quite a few people I've spoken with, on the show and up, you get burnout and it's hard to stay the course. And, you know, there are lots of reasons why you just don't want to go up that high because, some people say it's because women don't want to be seen. It's like, no, that's not true. But, there's so many issues that hinder us making that kind of progress. So, what is the sort of advice that you give people to stay the course, especially when it gets to those challenging parts where you just want to burn out or want to see change and you want to explore something else?
Well, part of the problem, part of the thing is, and it's funny. I work for a company that is out of Alabama, and it's a definitely different feel in that part of the United States. And I have absolutely, there's still that scenario that the wives stay home, they don't work, and so it is when you are a working mom and an involved mom, I am, I try to be, and run a household and run a company, there's
Mm,
burnout. There's a lot of burnout. It is hard. I still work, especially in technology. This, be honest, I work with a bunch of men, and I've sat in many a meeting that I'm the president and CEO of the company, and they'll turn to my two partners and talk to my partners, and that is still happening to this day. To this day, that is still happening. You have to go in that meeting, be prepared, and speak your truth and be able to do it. And sometimes you have to speak your truth and let them get all the stuff out and then just come back and be ready to be enough push back to make them understand that you're in control, you're doing this, and you're the decision maker. And that is hard because you'll hear things for all the women out there. You're just being
mm,
emotional. You're emotional because the way we handle things are very different from the way men handle it. And they'll say things like, "Oh, you're being emotional," or "You're not listening to me," that kind of stuff. And you say, "No, honestly, you're not listening to me," and you have to be able to push back on it. I think for my generation it's a little harder. It's getting a little easier. Generations behind me, um, there is still in I'm probably, I'm on the higher, like, from each generation helps a little bit going down. And I do believe the generation below me and one below them is going to have a little easier push for it. But we have to encourage women to be able to balance it. And they have to encourage, it's very important who you decide to be your partner, your mate in all this. Because if I didn't have a husband that actually supported me and supported me through this, knowing when I have to be on the road, right? So he's got to step up and take care of the kids, those kind of things. The other thing, ladies out there, surround yourself with your tribe, because when I'm traveling, I'm out there. God forbid something happens to my kids. My girlfriends are there 100% of the time. I've got a problem. They are like, when my son got diagnosed with diabetes, is a we had to take him to the hospital. We had to get him down to Georgetown right away. And I called two of my girlfriends. One couldn't hear me; she was like out at a fair. The other one heard, and both of them, one who didn't know what was going on but could hear it in my voice, and the other one came, and they showed up in front of my house and grabbed my other kids and took care of it. Those are the people you want surrounding you. You're going to have a tribe, and you have to have the encouragement. Surround yourself with really good people and you'll get there. And just be strong in those meetings and know your convictions and do it. You know what, we can power through anything. We're women. We do 1,000 things. This is just one more thing we got to do. So just go for it. Don't get burned out. Make sure that you do self care and you make sure that you've got your tribe and you can do it. You can get there. You can and do it. And again, surround yourself with really good people. My business partners, we've been business partners for 22 years. Those guys are ride or die. And the two men, very opposite men, very there. But, if any other man in a room go after me or say something, they are 100% right there for me. And so surround yourself with the good people and you'll be just
Yeah,
fine.
amazing. And that's really such an important thing, because even, all of us have different paths, and we're not going to have the same kind of objectives as all of our friends, but you don't need to be able to have that kind of support and have that kind of encouragement or mentorship, or, just a general support network who can provide that kind of assistance in whatever capacity that you need.
Yep, you're having a bad day. It could be that they come over and one time I was having a really bad day with actually a boss that a guy that just wasn't listening to me, and I was just so frustrated. And one of my employees, who's a good friend of mine, just showed up at the front door with a bottle of gin. Here you go. I was like, she's like, I don't know what's going on. I don't need to know. I can hear it in your voice. Here's a bottle of gin. And like that, like you're like, she got me. She knew who
Yeah,
I was. So, it's just that kind of support. And you surround yourself, and it doesn't have to be just women. It
yeah,
could be men. I mean, again, you build that network, you do it, but just make sure that you've got, remember, it's okay to cry, because a lot of times women express that more in tears than men. It's okay to have a cry. It really is, because for us that releases
mm,
tension, that takes it, and then you can think clearly. But after your cry, sit down with a piece of paper and plan out your path, and just go ahead and attack it. And it's okay to be upset, and it's okay to be just take that energy that you're having there and say, okay, I'm over
yeah.
that.
What's next?
What's next? Where do I move? Yep. Yeah. And you'll just do fine. I've
Yep,
been able to. I've been able
amazing.
to. And I still am doing it to this day. To this day. You got a great group of people around you in this world. And we're all, as much as the world's tough right now, there's so many different things going on. People are still there to support one another. You see it in everyday life. And surround yourself with really wonderful people, really thoughtful people. Keep challenging yourself. And guess what? You'll get your dream. You'll get your dream. And your
Yeah.
dream could be to be the CEO or CTO. I'd like to see more CTOs out there, guys. Um, uh, CEO, CTO, whatever. Or it is to be the best darn developer you've ever been in your whole life, or a project manager. And sometimes maybe it's the best mom. If that's your path, take that path. because I'm personally,
Mm.
as a mom, being a stay-at-home mom has got to be the hardest job in the whole freaking world. So more, like whatever your path is, follow that path, and we're all okay with that. Just we're all here to support one another.
Mm. Absolutely. Okay, and so it's probably a good time to move on to some of those extra questions.
Yes, there we go.
Right, so what hobby or interest do you have that is most unrelated to your field of work?
Well, it used to be a part of my field work, but shopping is very important. I'd love to go shopping. So I definitely I love a little retail therapy. Theater. I love the theater. So my husband and I are members of the Kennedy Center here in Washington D.C. You might know. I think it's kind of
Yeah.
worldwide. People know what the Kennedy Center is, and we've got season tickets. Love to go to the theater. Love to go. We just saw To Kill a Mockingbird. I can't even tell you how
Oh,
phenomenal
wonderful.
that was on stage, which is incredible. We're in Hamilton in a couple of weeks. So really going to the theater, being out and doing those kind of things, which helps my retail therapy because I have to dress for the theater. So that's it. That's it.
Of course.
But I just love it. I used to do theater when I was young, so this is something like I really
Oh, really?
totally enjoy. Yeah, yeah.
That's
Having a
very
speech
cool.
problem back in the day, so I had a major speech problem. So my
Ah.
parents put me on stage with my brothers and sisters to work on diction and being able to do it. So
Ah.
I had really smart parents. I was really lucky. So they got me out there and they got
Yeah.
me up on stage to get myself through that with therapy. So I love it. It's fun.
Yeah, that's such a great tool for that because a lot of people, they do speech pathology,
Hmm.
but it's also about building confidence in being able to articulate when you're having, speech issues.
Absolutely.
So, theater is a perfect complement for that.
Yep, they got me up on stage, and all four of us, all four kids, went to summer theater all the time, and we did theater all the way through, and music. We're kind of musical, and singing and things like that. So you learn to do it, but made me fall in love with the theater, and it is
Yeah.
fun. I'm actually just got tickets to Broadway to my sister for her birthday to see Music Man with Hugh Jackman.
Oh,
So
wonderful.
from your area, Hugh. So
Yes.
he's on Broadway right now. So we're gonna go see Hugh Jackman in November in New York.
That is amazing. Yeah, I
Hmm.
love theater. Theater's great.
Fun. It just
Yeah.
it breaks up. Our lives are so tough, but to go to the theater and just kind of be immersed in it is phenomenal.
Mm.
And you go out to dinner beforehand, you do the whole thing. But sit there and listen. And we got to go to the 50th anniversary of the Kennedy Center. I've never had theater musical. Everything about it was just phenomenal. It's one of the best things I've ever seen in my life. So I highly, you guys find something out there that makes you joy. That's really fun for me.
Yes, absolutely. Okay, and which childhood book holds the strongest memories for you?
So I have a couple of them. One is Little Women,
Ah,
by Little Women, Little Men. And then I know everybody talks about Nancy Drew, which is like a big here in the U.S. Like Nancy Drew. I
yes.
love the series called Trixie Belden. Nobody really
Ah,
knows it.
yeah,
It's
Trixie
about a
Belden.
young detective girl out of upstate New York. And
Yes.
did you ever hear of it, Trixie Belden?
Yes, I've heard of it. I can't remember. If I read it, it must have been, yeah, when
Oh,
I was reading Nancy Drew.
it was like
But
yeah, it's like
yeah,
I think they're written in the 1950s and 60s, but I
yeah.
love Trixie and Honey and all that. So I was the kid that I would be like where everybody's supposed to be cleaning the house, I would be in the back of the closet reading my book.
Yes.
I love books, so anything I can get my hands on. But back then it was Little Women, Trixie Belden, the Boxcar Kids, anything like that was my thing. So but even to this day, I just finished a book on Marjorie Post, which is the Post serial Harris, and that was those are interesting. So now I've done a lot more books on tape, so
Yes.
I can listen to books and tapes. But those are mine back in the day. Those are my two I
Yeah.
loved. Oh, the other one, Little House on the Prairie. Little House on the Prairie, the series Little House. So now what I do for Little House on the Prairie is my employees who have little. I don't have a little girl, so my employees have little girls. I for their seventh birthday or sixth or seventh birthday, I ordered them the Little House on the Prairie series, and I sent it down to
Oh,
them.
that's so
So
great.
it's a good one for them to start reading with their parents, and then moving up from there.
Yeah, that's great. I love the ones that you can share with the kids. Like they're not often like contextually the same as they were when you read them when you were kids, but there's still something really enchanting about those books. And, just the even the period pieces or the Nancy Drews and the Trixie Veldens. There's just something that's so fun and adventurous about being able to read what these lives were like, even though they weren't real, and going on these adventures with them. So
Yes,
for us, it was Enid Blyton and Famous Five, and all of that. So it was the same sort of idea where you just got to have these little adventures, and yeah, it's just one of those things that kind of sticks with you.
I loved. I mean, I actually have some Trixie Belden books around here. My everybody teases me in my family, but I'm like, oh my gosh, I just found them. So it's fun. I love it. It's always a good time.
Absolutely. And lastly, what advice would you give someone who'd love to do what you do, and what advice should they ignore?
What do you, should to do what I do? I think is to understand you have to learn all aspects of technology. So if you're a developer, you need to learn the business side of it. If you're a
Mm-hmm.
business person, you need to learn enough of the technology to understand the side. But ultimately, you need to listen to your clients and what's happening in the marketplace and be able to take that information and bring it up. What you shouldn't do is try, if you really want to get up to a CEO or CTO thing, you have to broaden. You can't go as deep as maybe you would think you want to. If you want to be a developer and you want to learn everything about code, then you go do that. But with a CTO position, you really need to be able to understand the solution of it, the architect of it, of what it is, and how other pieces fit into that puzzle. So on the CTO side, you have to have a kind of a mind for a puzzle. How does it all blend together? As a CEO side, you need to understand the sales and the marketing, the operations, and even if you're not
Mm-hmm.
great in the operation, you get somebody who is great in the operations because you might not want to ever do accounting all your life or
Yes.
legal. That's boring stuff, but I have some really good people that can do that. Um, but you need to understand the business side of it, but along with where product it is. So if you can bring those combination, and the number one thing is to build the team around you. Work with the right people, work with talented people. And it does not mean that everybody has to come out of Harvard or Yale or St. Andrews or anything like that. Sometimes your best people maybe didn't even graduate from college.
Mm-hmm.
So find the person that can think on their feet, that I always look at resumes and say when they're in college, did they work that job? Did they part of the clubs? And they can multitask. They can really find that multitasking and being able to do it would be good. And the biggest advice to me for everybody out there is sit down, plan your course, plan your path, and follow it. And not to be discouraged, just not to, people get stuck with a wall in front of them. You need to figure out how to get around that wall. You go around it, either side, go over it or dig a hole and go under it. Don't stop. Just figure the way around it. It's an old Boy Scout song that says you can't go around it, you can't go over. You got to get up. So you have to figure out a way around it to be able to get to that pace. So if you have a goal, figure the way to get to that goal.
Mm. And it's just so many of these sorts of things that come up. Like a lot of people have said that they've planned their path and it's not been a straight line, and it's never going to be a straight line. But if you have an objective, like you know where the goal is, it doesn't matter how you get there, because you might find alternate routes to get there, and that's okay. And sometimes you have to take a side step instead of going up. And a lot of people consider that a failure, but it's not. It's a deviation, it's a detour. You learn from it, and it gives you more experience for the next step. And it's a lot of people are so narrowly focused, they forget that it's okay to deviate, that it's okay to be diverse in your interest and in your route.
So I always tell my kids that it's not a sprint, it's a journey,
Mm-hmm.
and we're on a journey. I started in retail, and I ended up being the CEO of a software development company. Who would have thunk it, right? I'm terrible at math, so I would never be a developer. Um, and but with all these different paths following my passion, I just ended up being at that spot.
Mm.
So right now in the world, and I'm dealing with college kids that just aren't enhanced of coming out of 2020 where they were stuck in dorms and they couldn't
Yeah.
do things and et cetera. There's a complete turning point for these kids, and now they don't believe in college anymore. They don't
Mm-hmm.
believe in that path, and they're figuring out different ways to get to where they need to be. I am fascinated to see where these kids end up. My kids actually went through not my son was born during 9/11. I mean, literally like
Yeah.
9/11 for us here. So his classes had this really bumpy road because there's all kinds of things for them.
Mm-hmm.
I am fascinated because of that, though. They became really strong kids. Fascinated to see where they end up, but their journey is going to be different than yours or my journey, and we
Yeah.
have to support that. But people, your journey is your own journey, and just figure out your passion, where you want to be, and just keep going till you get there.
Exactly. And that was one of the things that came out of 2020. A lot of people were saying, this is going to be a year of my life that's lost. This is going to be whatever years of my life that's lost. It's like, no, because, the path that you took isn't available anymore. Find a new one. Make this year not a loss, but a preparation for the next one. And being able to position yourself in a way that can pick up and continue on in a different spot. And it's another one of those things about resilience. And I've been reading Angela Duckworth's book on grit, and it is about that. It's about finding that you do have alternate routes, alternate paths, and it's not about where you're stuck on. It's how you get past it.
It really is. Um, it's hard. I'm up for an award called the Moxie Award, having moxie,
Yeah,
and being able to adapt to get there. And it's been interesting watching. I have a 20-year-old who graduated in 2020, didn't have graduation,
yeah,
homecoming, or anything, and it was really tough on these kids, incredibly tough on these kids, and to watch these kids, and some of them stayed with the college course, some of them stepped out for 2 years, and then they're going back in. And what I find really cool about these kids is they're not judging one another.
mm,
They're not like, it used to be that you had to be there 4 year, you had to go to the, they're
yeah,
now like, hey man, just take it at your own pace. And I think they're teaching us something
mm,
of saying it's okay to slow down, figure out the next steps before you jump. And it's better for your mental health. It's better for where you want to be. And maybe you're making a better choice. You don't waste that 4 or 5 years that we all thought our careers are going somewhere. And then you're like, I hate this, right? They're going to college after they're going to college, they go to school a little later going, I'm really passionate about that. I'm going to go to college for that. How many of people we know went to college and got a degree and they walked out and said, I don't think I'll ever use that. I have friends who are accountants and they're like, went for accounting and they're like, I don't even like accounting. I'm like, did you just graduate an accounting degree? So
yeah,
it's a little different, but again, just find your own path. You'll be
absolutely.
fine.
Yeah, and coming back to your thing about not going too deep when you're actually heading towards leadership roles, it's an interesting thing because you know it's more common now that you get your tech and STEM degrees which have a side of business or a side of project management, and it's those sorts of things that are so important because you need to be able to understand all these other soft things in order to succeed in your technical field. And having that breadth of scope of going, I'm an engineer, I know how to build this thing, but I need to understand the business aspect to understand what's important in a business for what I'm building. And I need to understand budgeting because if I'm going to be running teams, I need to understand how all of this stuff works and how you allocate funds and allocate resources. And it's as a dev myself, I freelance, I run my own business, so business of one, but it still means I have to understand business development and talking to my clients, not just about building what it is they want verbatim, but understanding what their business needs are and how to adapt to what their objectives are, and talking about, you know, what other aspects of business other than software that's important to them that will be valuable to them. And having that broader scope is, it makes you better at what you do because you're getting an idea of the bigger picture and you can transition from operational to strategic in a more, it's a more balanced and more flexible way, which means that you are positioning yourself for, management leadership if that's the way you want to go, or in, if you want to go the other streams, you can still, you know, run teams or run your own business and it still works that way as well.
Absolutely. I work at the University of Maryland, and they have something called the Quest team,
Mm,
and on the Quest team is you had multiple. Everybody's learning all those pieces, right? So they did a project for us, and Ashley won the capstone award of the project they did, which was great because we're up against Pinterest and Lockheed Martin, all these large corporations, and our team won. But it was they able to bring all the business side into it. The other thing is really important is you need the business side, you need the development side, you need the UX UI side.
Yes.
And that's human, the human interactive of what actually happens when you're on a website or
Yeah,
an application, and understand the humans. And so that's a whole
it
psychology
is.
piece that is now coming in. And we've seen, actually one of my employees just graduated with a master's in it. We're starting to see that coming into play too. So, and my youngest son is a graphic artist and digital artist, and seeing where he's only 15, and but he's already in that side of it, right? And that's a whole different side of STEM.
Yeah.
We think about development, but then you got this artistic side that he's able to bring in. So it's bringing all those aspects together to build something really creative.
Hmm.
So you have to have all those pieces. Even if you don't, you want to go out and find the best of breed that do have that, the best people out there that can train you enough that you understand the importance of it, but you can rely on them to take it to the next level.
Yeah.
So it's really, I just think it's really interesting where we're going,
Hmm.
with all of it. So, and especially having our artists down the road, down, I mean, I'm at home right now, right down the hallway from me,
Yeah,
and be able to see. And yeah, if you want to get, have a real wake up if you're not knowing what you're doing, talk to your teenage kids. They'll tell you all about, like, what is that?
absolutely.
And you realize, yeah, you got to stay ahead of it.
Yeah, it's the
It's really
future.
good.
And that's one of the things that I love about the health sector because it's full steam, like which is the whole point of this show. Because, you've got your medical, but you've got the software side, the psychology side, because you need to understand the patients and the users and how way they work and the way they use things. But you also have, the ethics of how you manage your content and, policy and legal and all of the other things all make up part of what you do on a daily basis. And it's not just building a software platform and selling it. It's so much more than that because it's really about the people, and that's what's amazing about this field.
It really is, and that's what makes it fun.
Yeah,
It makes it fun. And just because you maybe didn't go to college for computer science or things does not mean that you don't belong in this journey and in this fun, and to be able to do it. It's really cool to see the passion I've seen people have been able to do with it. So yeah, no, come join us. It's really fun. It's really fun, and it's the future. It is where the future is going.
yeah. Well, this has been such an amazing conversation to have with you today, Robin. I've really appreciated talking with you about, all this, everything about the way that, you know, Get Real Health works and what it's trying to do for the people and all the different considerations and how, you do expand to other groups and other countries and, being able to support all of these aspects of integrated health. So if people would like to learn more about what you do, where can they go?
Well, you can do a couple different things. You can definitely go to getrealhealth.com, but follow me on LinkedIn. I mean, that's usually the best way, so it's, Robin Wiener, Wiener, because a lot of people miss that a little bit. And follow me, honestly, on LinkedIn, and you'll see a bunch of information coming out all the time. And kind of, we talk a lot about, uh, not only just our press releases come out, any of it, or follow Get Real Health on LinkedIn or on Twitter. That's really where we put a lot of the information out. And but yeah, no, we really, please follow us and see what we're doing and where we're going. And would love to hear from people. It'd be great.
That's wonderful. Yeah, so thank you again. This has been amazing, and I hope you have a great rest of your evening.
I will. I will. It's getting a little late here, so I'm ready to go to head to bed. I'm here on the East Coast of the United States, so
Absolutely.
it's a bit on the different time zone.
Yeah.
But thank you, Michelle. This was fantastic. I really enjoyed our time.
I love speaking with Robin today about her journey from fashion to healthcare IT and the importance she places on the human side of business. It's also been fascinating to hear about what it takes to create an internationally used digital health platform, one that not only empowers patients to manage their own healthcare needs, but also has a focus on privacy and consent. To learn more about Robin and what we discuss on the show, or to connect with us, please visit the Steam Powered website at steampoweredshow.com. You can also find out more about Get Real Health at getrealhealth.com and find Robin on LinkedIn, the links of which will be in the show notes. If you enjoyed this conversation, please let me know. Subscribe to the show, leave a review, and share this with your geeky or geek-curious friends. You can also support Steam Powered on Patreon and Ko-fi and the Steam Powered Show, the links for which will also be in the show notes. Thanks for tuning in, and we'll see you next time.